My name is Justice, and uh, my research topic is the return of bowel sounds, indicating an end of postoperative Ileus. Is it time to cease this long-standing nursing tradition? And the outline for this study consists of the introduction, the purpose, method, the findings, and the conclusion. And the introduction is an experimental quantitative research article. Effectiveness of listening for return of bowel sounds to indicate the end of postoperative Ileus in patients. And the research question is auscultation of the abdomen effective for indicating the return of GI motility or the resolution of postoperative Ileus after abdominal surgery. And the problem was that postoperative Ileus occurs almost universally among millions of patients worldwide after abdominal surgery. And evidence-based nursing literature has challenged the long-standing traditional practice of using auscultation. And the purpose of the study is to provide randomized clinical trial and rationale supporting evidence-based inquiry concerning postoperative Ileus. And the hypothesis is specific indicators such as passage of first-time postoperative flares could be a more reliable means to indicate a return of GI motility or the end of postoperative Ileus compared to the use of bowel sounds. And the independent variables are the effect of rocking chair motion and the standard care on postoperative Ileus. And the dependent variables are going to be the return of GI motility or the resolution of postoperative Ileus. The significance to nursing practice is to alert nurses to acknowledge that the return of bowel sounds does not indicate the end of postoperative Ileus. And the theoretical framework of the study is an evidence-based project and studies by Mercer, challenging the auscultation of bowel sounds as a reliable indicator for end of postoperative Ileus. The sample or the inclusion criteria of the study is a patient who are recovering from surgery performed to remove cancers, and then those who can speak English, cognitively intact, and able to ambulate, sit in a chair or rocking chair, and also being able to receive epidural analgesia. The intervention and the setting of this research is the Iowa model of evidence-based practice, and then it took place at the University of Texas, MD Anderson Cancer Center. And the design is a two-group post-test only, randomized controlled clinical trial. Post-test design was chosen because measurement for resolution of POI could only occur after abdominal surgery. And then the data collection was guided by previous evidence. And standard operative care involved having the patient out of bed, sitting in a rocking chair, and ambulating beginning the first day, with care continue until resolution of postoperative Ileus. And caring for intervention group involved having the patient out of bed, rocking in the chair for 10 to 20 minutes. And then the statistical methods are going to be analysis for time to first bowel sounds and the time to first time flares, and analysis for association. And the result of the study was that no statistical significant difference were found in time to first bowel sounds between the non-rocking and the rocking groups. And there was also no association between first flares and the return of bowel sounds. And the reliability of the trial, recruited patients share similar characteristics based on the set of inclusion criteria for the study. And also the trial for randomized to prevent biases. The strength and weakness of this study is that results were clear and concise to support the evidence-based inquiry that questions the relevance of the traditional nursing practice of listening to bowel sounds. And also, trial reveal clinical significant effect of standard operative care and care for the intervention group for the resolution of postoperative Ileus. And also, to their strength, to the weakness, population used for the study was not extensively explained, and no specification on age, gender, distribution of the study were given. And we can also look at the small sample size of the study being a weakness. And then the ethical and legal concerns. There were no legal or ethical concerns that was identified. Approval was obtained from the Institutional Review Board prior to implementation of the study. And then the informed consent was obtained prior to surgery from patients who met the inclusion criteria. And then implication for nursing is that nurses should use attestation with caution in patients with POI conditions. And then future research and evidence-based evaluation of indicators, passage of first flares, elimination of abdominal distension, nausea, vomiting, and tolerance of diet. And then conclusion for this research is that no association between return of bowel sounds and end of postoperative Ileus was identified.